So now classification of infectious folliculitis. We will talk about the folliculitis. There is a broad classification. There is infectious folliculitis, bacterial, fungal, viral folliculitis, infestation. And there is also actinic folliculitis within 24 hours after sun exposure. The bacterial folliculitis includes the staph folliculitis, which we will talk later, superficial and deep types, and Pseudomonas aeruginosa, hot tub folliculitis, gram-negative folliculitis at the site of acne vulgaris due to antibiotic treatment, and syphilitic folliculitis, acneiform. And the fungal folliculitis includes dermatophyte folliculitis, Asthenia capitis, Taenia barbae, and Majuki granuloma, and Pityrosporum folliculitis and Candida folliculitis. Viral folliculitis, herpes simplex virus folliculitis, follicular molluscum contagiosum, and itchy folliculitis of HIV infection. The infestation, decidiosis, and also there is the perforating folliculitis. And we said the xenophilic pustular folliculitis in HIV patients. This is a broad classification of infectious folliculitis: bacterial, fungal, viral, infestation, and actinic folliculitis. Bacterial, staph folliculitis, superficial and deep, we'll talk later, and Pseudomonas aeruginosa folliculitis, hot tub folliculitis, gram-negative folliculitis at the site of acne vulgaris due to longitudinal long antibiotic treatment, and syphilitic folliculitis, acneiform, fungal folliculitis, dermatophyte, Pityrosporum folliculitis, and Candida, viral herpes simplex virus, molluscum contagiosum, and HIV infestation, Demodex infestation. And there is perforating folliculitis and eosinophilic folliculitis of pustular folliculitis, and we said that there is actinic folliculitis also. Now, as regarding folliculitis also, the folliculitis is inflammation of hair follicle caused by either infection, as we said, like staph, and or physical irritation or chemical irritation also. So the folliculitis, there is deep and superficial folliculitis. The bacterial, we will talk about deep and superficial folliculitis. The deep folliculitis in the lower portion of the hair follicle, and from the isthmus and to the lower erector pili and down, and for the superficial folliculitis from the infundibulum to the isthmus of the hair follicle. The deep folliculitis: boil, furuncle, acne colloidalis nuki, and psychosis barbae. For the superficial folliculitis, there is Burkhardt impetigo, pseudofolliculitis barbae, and acute acne necrotica varioliformis. So there is the deep folliculitis: boil, furuncle, and acne colloidalis nuki, psychosis barbae. Superficial folliculitis: Burkhardt impetigo, pseudofolliculitis barbae, and acne necrotica varioliformis. Superficial folliculitis. The superficial folliculitis has acute and chronic. The acute is follicular Burkhardt impetigo or osteofolliculitis, and the chronic is acne necrotica varioliformis and pseudofolliculitis barbae. This is the superficial folliculitis. The superficial folliculitis we will talk about is first the acute type. Okay, of course we said that the superficial folliculitis is confined to the ostium of hair follicles, either physical and chemical or infective. So here the first one is the acute form, acute or follicular or Burkhardt impetigo osteofolliculitis. It is infection of the follicular ostium with staph. The etiology: organisms Staph aureus. Predisposing factor may complicate itchy skin conditions or use of topical steroids. Clinical age mostly in children, especially in scalp and limb. The lesion is dome-shaped pustules at the orifice of hair follicle, with hair piercing its center. Very easy. Dome-shaped pustule at the orifice of hair follicles with the hair piercing its center, usually in the limbs or scalp. Healing with 7 to 10 days with no scarring, because it is superficial. And the treatment is topical and systemic antibiotic, and treatment of predisposing factors as itchy skin conditions. As we can see here, this is a picture of Burkhardt impetigo. And also Another picture of Burckhardt and Petago. The second type is acne necrotica varioliformis. The acne necrotica varioliformis, it is a chronic follicular necrotizing process. Etiology: Staph aureus or Propionibacterium acnes. Predisposing factor: emotional stress. Clinical picture: recurrent small red follicular papules and pustules which undergo central necrosis and heal with small pitted scars. There is a type which is acne necrotica miliaris. It is a milder form occurring throughout the scalp without scarring, and it's due to its superficial location. So the acne necrotica varioliformis, it is only a papules or pustules on frontal hairline, and it leaves pitted scars. It's either due to Staph aureus, as the rest of our folliculitis, or sometimes also it is of Propionibacterium acnes cause. The pseudofolliculitis barbae. It, of course, this is the treatment of antibiotic, either tetracycline or if it is due to Propionibacterium acnes, or staph antibiotic if it is from staph. Pseudofolliculitis barbae. It is a foreign body reaction to the hair in growing hair into the skin, resulting in foreign body reaction, red papules and pustules. The etiology: microorganism is not responsible. The inflammation resulting from the sharp edges of the hair that curve backwards after emerging from the follicle and penetrate to the adjacent skin. It's more common in the curly hair which become ingrown. And the clinical picture: papules and pustules irregularly scattered over the shaved area, especially the beard skin of the neck and over the jaw. The treatment is shaving too infrequent, maybe after 6 weeks or each 6 weeks, and we use topical combined steroid and antibiotic as Fusicord. Sometimes we use diode laser and finish the hyperpigmentation with a little glycolic acid or something. So this is the pseudofolliculitis barbae. It's a foreign body reaction. Sterile pustules. See here a picture of pseudofolliculitis barbae. This is another picture of pseudofolliculitis barbae. Now we will talk about the deep folliculitis. The deep folliculitis, there is also acute forms, which are the furunculosis and the furuncle boil and carbuncle, and the superficial part, which is the psychosis barbae and acne colloidalis nuchae. Okay, first the acute part is the furunculosis or boils. Definition: it is acute deep folliculitis. So it is deep and it is acute. Acute deep folliculitis. Don't go to the trick. Acute deep folliculitis of a single hair follicle and with the surrounding skin. It is acute deep folliculitis of a single hair follicle with the surrounding skin. The etiology is the staph, as all we were talking about is staph. Predisposing factor: decreased body resistance in diabetes, nephritis, anemia, HIV. And itchy skin conditions: scabies, sweat rash, atopic dermatitis, and alcoholism. Boil begins as a small inflammatory nodules that develop into about the hair follicle and extend and penetrate deeper, deep-seated, and then become permanent necrotic center, boil rupture, post-discharge, more boils all around. So it is hard, tender, red follicular center nodule that become painful and fluctuant abscess, and then pus become discharge. And the site is hair-bearing sites as thigh, buttocks, and face, neck, and axilla. So the furunculosis is acute deep folliculitis of a single hair follicle with surrounding skin. Etiology is staph. Predisposing factors as itchy skin condition and low body resistance and alcoholism. And a clinical picture: it is a hard, tender, red folliculocentric nodule that becomes painful and fluctuant, and maybe a pus after that is discharged. And treatment is systemic and local antibiotic. So this is a furuncle. It is acute deep folliculitis of a single hair follicle. Acute deep folliculitis, the one to the right, is a furuncle. The carbuncle is larger and more serious inflammatory reaction with a deeper base characteristically as extremely painful lesion at the nape, extremely painful lesion at the nape of the neck, sometimes in the back and thigh. Etiology: the organism is staph. Clinical picture: the involved area first is red indurated, become multiple pustules on the surface, draining externally around multiple hair follicles. Lesions soon lesion develops yellow-gray irregular crater at the center, which heals slowly, leading to granulation and scarring. This is the definition, etiology, and clinical picture of the carbuncle. It is a larger and more inflammatory lesion with a deeper base characteristically with multiple hair follicles. It is multiple hair follicle, extremely painful on the nape of the neck especially, and back and the thigh. The etiology is staph, and it is first red indurated, then multiple pustules arise on the surface, then become giving yellow irregular crater, and then granulation tissue and scarring. This is the furuncle, the carbuncle. This is the carbuncle. Multiple draining and multiple openings. The psychosis Barbie and the acne keloidalis nuclei, they are deep folliculitis. Psychosis Barbie or folliculitis Barbie. It is subacute or chronic staphylococcal infection involving beard, mustache, or any occurs in the men after puberty. The folliculitis decalcans is the same process involving the scalp. The etiology is staph aureus, and it is edematous red follicular papules or pustules centered on a hair. Usually remains disparate over the beard or upper lip, but may coalesce to form raised plaques studded with pustules. Differential diagnosis, of course, from pseudofolliculitis Barbie and tinea Barbie. Tinea Barbie is Acarian-like, and pseudofolliculitis Barbie mostly is papules, not pustules. So here, the psychosis Barbie, it is a chronic staphylococcal infection of the beard and mustache area. Treatment, of course, is systemic and topical antibiotics. Clinical picture: edematous red follicular papules and pustules centered on hair follicles, usually remain discrete and on the upper lip, butt, and beard, and may coalesce to form raised plaques studded with pustules. In lupoid psychosis, the follicles are destroyed by scoring. So the psychosis Barbie, we can see here, this is a picture of psychosis Barbie, which is a deep chronic folliculitis. And also here, this is another picture of psychosis Barbie. The second type of chronic deep folliculitis is acne keloidalis nuclei. The acne keloidalis nuclei, it is a chronic deep folliculitis with formation of keloid-like papules and plaques on the nape, occipital, scalp, and posterior neck in males after puberty. And etiology is unknown, maybe friction by color, brushing hair, or autoimmune because it responds to steroid. The eruption occurs upon the back of the neck and form raised transverse band at the lower margin of the lower scalp. Here we give the treatment is intralesional steroid, and we can give topical steroid and with fusidic acid like Fusicort. We give here high dose of steroid to induce atrophy, 20 milligram to 40 milligram per milliliter of Kinacort injection, intralesional. Here this is a picture of acne keloidalis nuclei. So the folliculitis in brief. The classification of infectious folliculitis, either bacterial folliculitis, fungal folliculitis, viral folliculitis, and infestation. bacterial, Staph aureus, superficial and deep, we'll talk later. Pseudomonas aeruginosa, hot tub folliculitis, gram-negative folliculitis, and syphilitic folliculitis, fungal dermatophytes, Tinea capitis, Barbie, and Majuki granuloma, Pityrisporum folliculitis, Candida folliculitis, and viral herpes simplex folliculitis, follicular mascum contagiosum, and itchy folliculitis of HIV, infestation, Demodex infestation, and perforating folliculitis and eosinophilic pustular folliculitis. Of course, there is also actinic folliculitis within 24 hours after exposure. And the folliculitis, as we said, is inflammation of hair follicle caused by either infection, usually staph, and physical irritation, chemical irritation. This is the figure of deep and superficial folliculitis. The boil, acute, and the acne keloidalis, nuki, and psychosis Barbie, chronic. This is the deep folliculitis. The superficial folliculitis, the acute is Burkhardt impetigo, and the chronic is pseudofolliculitis Barbie and acne necrotica varioliformis. Superficial folliculitis, the Burkhardt impetigo, and the acne necrotica varioliformis, and pseudofolliculitis Barbie. All are caused by staph treatment, anti-staph treatment, and clinically, as we said. The deep folliculitis is the acute forms is furunculosis, boil, which is acute deep folliculitis of a single hair follicle, and the carbuncle, which is acute deep folliculitis of multiple hair follicles, and also the chronic forms of deep folliculitis, which is the psychosis Barbie and acne keloidalis nuki. At the end, there is a quiz here. What is the bacterial disease that is treated with antifungal? It is the erythrasma. We treat it by miconazole cream. And what is the viral disease that is treated by antifungal? The oral hairy leukoplakia. It is treated with itraconazole. And also others like podophyllin and alcohol, surgical excision, and cryo laser. The Corynebacterium infection. The Corynebacterium infection, which is gram-positive bacteria, there is two types, the aerobic type and the anaerobic type. The anaerobic type is the types of the acne vulgaris, as Propionibacterium acnes and Propionibacterium granulosum. And the aerobic type, which we'll talk here, is the erythrasma, which is caused by Corynebacterium minutissimum, and pitted keratolysis and trichomycosis axillaris. The Corynebacterium infection is either anaerobic as Propionibacterium acnes or aerobic as Corynebacterium minutissimum, causing the erythrasma, pitted keratolysis, and trichomycosis axillaris. We will talk about the erythrasma. The erythrasma is a mild chronic localized superficial infection of intertriginous skin. The cause is Corynebacterium minutissimum, and clinical picture usually predisposing factors old age, obesity, and diabetes, sometimes pruritic, and the lesions is well demarcated, first erythematous and then become brownish patch with wrinkled skin, fine scales, mainly on axilla and groin, and sometimes two clefts. And diagnosis by Woods-like examination gives coral red fluorescence, and the treatment is topical and systemic erythromycin, and topical fusidic acid, and miconazole cream, dactarin cream. This is the erythrasma. There is also other things that can give red color or pink fluorescence with Woods-like examination, as some necrotic tumors, normal tongue, normal skin follicular openings of the face and upper trunk, maybe Propionibacterium, and the acanthosis nigricans and groin and axilla also gives this pink fluorescence. So the erythrasma, we can say it is a mild chronic localized infection of intertriginous area. As we can see here, this is the erythrasma of the intertriginous area, and sometimes it occurs also in between the fingers, and we can see here in a more chronic case of erythrasma. The second disease caused by Corynebacterium minutissimum is the pitted keratolysis. The pitted keratolysis is a superficial infection of the skin caused by species of Corynebacterium, leading to numerous small erosions of the sole. Sometimes hyperkeratosis is present, and the treatment also is the same, plus treatment of hyperkeratosis, the same as erythrasma, which is systemic erythromycin and topical fusidine and actarine, treatment of hyperkeratosis with aluminum chloride 20% in absolute ethanol. And this is a nice picture of pitted keratolysis. The third disease is trichomycosis axillaris. The trichomycosis axillaris is superficial infection of axillary and pubic hair caused by species of Corynebacterium, which grow within and between cuticular cells and may invade the cortex. There is adherent sheet and nodules on the hair shaft, which could be yellow, black, or red. The axillary sweat sometimes colored together with clothing. And differential diagnosis of Piedra, white and black Piedra. The treatment of Piedra is benzyl peroxide and shaving. And the treatment here is also the better is to shave the part or the axilla or whatever. And also the same treatment of the other two diseases, which is systemic erythromycin and topical fusidine and actarine. So this is the trichomycosis axillaris, as we can see here. This is the three diseases: the erythrasma, trichomycosis axillaris, and the pitted keratolysis. Pseudomonas infection. We will talk about Pseudomonas infection, this funny diagram to the right. Pseudomonas infection is it's an aerobic gram-negative organism that sometimes even grow in the distilled water and maybe may lead to various clinical features. So it is a Pseudomonas aeruginosa infection. It's aerobic gram-negative organisms. In infancy, infection of umbilical stump, peri-umbilical, full swelling, green discharge with spreading erythema. Otitis externa, sometimes we give echinocomb in that, and green nail syndrome, onycholysis of distal portion with greenish discoloration of the nail, peri-onychial pustules with greenish discoloration of nails, or onychomycosis with greenish discoloration. This is usually from Pseudomonas infection and molds. Swimming pool rash, swimming pool granuloma, or Pseudomonas aeruginosa folliculitis. This is a macular, papular, or pustular folliculitis occurring after swimming in hot tub or public swimming pool. Healed spontaneously within 7 to 10 days. Macerated two-web infection, gram-negative two-web infections. Sharply demarcated maceration, tinged green with green fluorescence under Wood's light, and may begin with dermatophyte infection, and Pseudomonas is a secondary invader. Gram-negative folliculitis, although commonly due to Klebsiella or Enterobacter, it's also maybe due to Pseudomonas. We give antibiotics for a long time, and there is an imbalance that happens and leading to growth of gram-negative bacteria and giving the gram-negative folliculitis. For treatment of that, we give Roaccutane or benzyl peroxide cream. Secondary infection of wound and burn lead to fever and shock, and there is a serious one, which is septicemia in a compromised host or with leukemia or severely burned patients. Grouped hemorrhagic vesicles that ruptures, leading to necrotic ulcers, ecthyma gangrenosum, commonly occur in buttocks and extremities. And the treatment in localized area, 1% acetic acid compresses and silver sulfadiazine cream and intravenous gentamicin and or we can give ciprofloxacin as a treatment. This is the funny diagram we're talking about. In infancy, the infection of umbilical stump, otitis externa, green nail syndrome, and onycholysis with the greenish discoloration, swimming pool granuloma, macerated two-web infection, gram-negative folliculitis, secondary infection of wounds and burns, and septicemia. And we can see here some pictures of the Pseudomonas aeruginosa infection. We see here the green nails 20 green nails, and together with also there is chronic candidal paronychia with it to the left, and to the right there is the hot tub folliculitis after bathing in hot tub and resolved without antibiotic therapy. Here we can see Pseudomonas aeruginosa, ecthyma gangrenosum, gummatal gray painless infarcted lesions with surrounding erythema, and also here is Pseudomonas aeruginosa, ecthyma gangrenosum. And that ends the Pseudomonas infection.